Dr. Abhishek Ghosh, consultant physician in Kolkata, and as well as associate professor of College of Medicine in JNM Hospital, Koldani. So I shall briefly discuss about understanding hypertension for the common people, for you, for whom hypertension is a very common disease, but often it is unnoticed. So our today's discussion will be on what is the high blood pressure and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. That means arteries, okay, which is coming out from the heart, and this creates pressure against the walls of this artery or blood vessels. This is called as blood pressure. So normally in healthy persons, it rises and falls throughout the day. Sometimes in majority, it is lower on the night, but higher when we work actually, but it may vary. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. You know all: heart attack, stroke, heart failure, maybe kidney problem, maybe eye problem. In general, persistent increase in the blood pressure is higher than the normal blood pressure is known as hypertension. So hypertension is not actually a state of tension or anxiety stress. It is actually rise in the blood pressure. So high blood pressure usually develops over time. It can happen because of the unhealthy lifestyle choices. For example, not having enough regular physical activity, obesity, smoking, excess alcohol intake, and as well as stress. So there are other risk factors that can also increase the risk of developing hypertension, such as age. So as people get older, the arteries get stiffen up and narrow. So there is excess heart needs excess pressure to pass the blood. So blood pressure increases as the also there is cholesterol or fat actually lies down on in our blood vessels. So artery gets further narrow. Family history of high blood pressure: one or more close family members, first degree family members like your mother's father, or maybe in the uh, just brother or father, like that, with maternal uncle. So with hypertension increases person's risk of uh, developing the condition. So first degree relative hypertension, you are also having greater risk of hypertension in the in some part of your life. Excess salt intake is also known to raise the blood pressure, so we must quit excess salt intake. Limit is set at up to 5 grams per day per person. Not eating enough foods with potassium can increase your blood pressure and the risk of stroke and chronic kidney disease. So potassium rich diet is important, especially we can get easily from if we consume at least 1 or 2 fruits per day. Eating processed and fatty foods increases the fat throughout the body and make the heart work harder to push blood through the body. So increased blood pressure is the result. And on the other hand, lack of physical activity is also linked to obesity and further to rise high blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. So moving on, hypertension does not have any obvious sign and symptom. That's why it is often called silent killer. It puts people at risk of several disease, as I mentioned, from cardiovascular problems to kidney failure, stroke, even eye damage and blindness. So hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether person have high blood pressure or not. That's why blood pressure measurement in a proper manner is very much important. So generally, when the symptoms do occur, they include morning headaches or tiredness, vision change, some buzzing in the ears, fatigue, nausea, maybe vomiting. But I am once again stressing, it may not be evident in present in all the patients. So regular monitoring of the blood pressure is very key and in the proper way. So that blood pressure must be measured in the sitting posture. Your back should be in rest, and also you should not cross your legs. You should empty your bladder before measuring the blood pressure. And you must not have in a stressful condition for accurate measurement of the blood pressure. So if person is experiencing some of the symptoms, as I mentioned, then definitely one should get their blood pressure checked. And fortunately, high blood pressure can be easily diagnosed and treated also. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in 2 numbers, systolic and diastolic. Now let's try and understand what does this number actually mean. So healthy and normal blood pressure should be lower than 120 by 80 millimeter of mercury, or it can also read 120 over 80 millimeter of mercury. So systolic should be less than 120, diastolic should be less than 80. Here the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessel when the heart rests between the beats. So you know, heart is not continuously contracting, so heart is contracting, relaxing. So that's why there is also two types of blood pressure, and both should be under control if we want to treat the hypertension properly. So if blood pressure level is more than 140 systolic or 90 diastolic, then the person have hypertension. If person have BP levels higher than this, then he or she might be at risk of developing the serious heart disease. On May 17th, we celebrate World Hypertension Day, a day dedicated to highlight the importance of monitoring blood pressure and bringing global awareness to the 1 billion people living with high blood pressure worldwide. The theme of this year World Hypertension Day is measure your blood pressure, control it, and live longer. Ensure that your BP is measured and controlled if it is elevated. The risk can be prevented and reduced by taking these steps toward the healthy lifestyle, such as regular exercise, healthy diet, quit smoking and alcohol intake, regular BP monitoring, which is very much important, stress management, and definitely medicine intake and adherence to the medicine. So if blood pressure is successfully controlled with such lifestyle modification, then it might avoid, may delay, or reduce the need for medication. So let's look at the strategies one by one. How we can adopt the healthy lifestyle. First is regular exercise or physical activity. Exercise can be a drug-free approach to lower the high blood pressure. Regular physical activity makes a person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessel will decrease and lowers the blood pressure. So you are just adjusting your heart to handle the extra pressure. That's why heart will find it easy to make the blood and to ensure that blood is flowing without much pressure. So in other case, as we are all aware that age and weight gain are two important risk factors for hypertension. So if the blood pressure is at desirable level, that means less than 120 by 80 millimeter mercury, then exercise can help prevent it from rising as you age. It also helps to maintain a healthy weight. So exercise as well as healthy weight maintenance, which is a very important way to control blood pressure. And one should aim for at least 30 minutes of aerobic activity most of the days of the week. And high BP level can be reduced by doing regular structured exercise such as brisk walking, jogging, or swimming, etc. Next important thing is healthy diet. So it also plays a very important role in controlling the BP. A diet with high intake of the vegetables, fruits, whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through the dietary intervention, one can adopt a dietary pattern which is called DASH diet, that is dietary approach to stop hypertension. That is one kind of Mediterranean diet. That means a fruit. We have to avoid high salt diet. We have to take much potassium enriched food, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of the sodium in the diet, and avoiding alcohol consumption. So remember, sodium chloride or the salt intake should be less than 5 grams per day per person. That means only if you count only sodium, then it should be less than 2.4 grams per day. DASH stands for the dietary approach to stop hypertension. So it includes, we should have a diet rich in whole grains, fruits, vegetables, low-fat dairy products, and that can it has been seen that that is very much able to reduce the blood pressure even up to 11 millimeter mercury if you are having high blood pressure. Reduce sodium in your diet, as I mentioned, 5 milligram, that is 5 grams per day, and that is able to reduce your blood pressure 5 to 6 millimeter mercury if you have high blood pressure. So to decrease sodium in the diet, we could consider some tips like we have to read the food labels if possible. Choose low sodium alternatives of the food and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in the foods. Most sodium is added during the processing. So you can eat natural products, then you can avoid the excess sodium load. Don't add salt. Just 1 level teaspoon of salt has 2.3 gram of sodium. So avoid adding salt to food. Use herbs or spices to add flavor to your food. Quit smoking. This is very much important because not only hypertension, if you smoke, then also it kills the heart as well as other organs. So stopping smoking helps you to reduce blood pressure, return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. And regular BP monitoring is very much important to know whether this lifestyle measure is actually getting and going to help you or not. So some of the hypertensive patients check their blood pressure by visiting doctors, but it is not maybe always possible because that takes time. So hence, most often I advise patients for self-monitoring of the blood pressure. It helps the person to measure blood pressure at different times throughout the day. So doctors will also have a better idea at which time your blood pressure is increasing, because there may be some individual variation in rise of the blood pressure trend in different parts of the day. It also assists doctors to get a more complete picture of the person's blood pressure readings at different times. Further helps us to better predict the cardiovascular morbidity and mortality rather than the single routine blood pressure measurement at the chamber. Okay. So regular blood pressure monitoring, preferably self-monitoring of blood pressure. Multiple devices are now easily available in different pharmacy shops that can be bought at home, and you can measure it easily. And you can record it so that you can present those data to your doctors. Stress management is another crucial thing. By learning how to relax and manage stress can improve your emotional and physical health and lower the blood pressure. This may include exercise, listening to music, focusing on something calm, peaceful, and meditating. And at last is the adherence to medicine. So if all other lifestyle measures even is not able to adequately control your blood pressure, then physician will start the medicine, and it may be recommended by doctor if your blood pressure is constantly high, usually at or above 140 by 90 millimeter mercury or more. Adherence is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is important to prevent cardiovascular complications as well as renal eye complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care, and if necessary, with regular medicine. Don't stop your medicines all on a sudden without informing the doctors. It can be detrimental and it can cause rebound hypertension. That means again your blood pressure may shoot up significantly to cause multiple problems. So adhere to your medicine, adhere to your lifestyle, which is most important to control your blood pressure, and that can be done easily if you are focused. Thank you.